I'm Dr. Edward Kammerer, Chief Quality Officer, Mosaic Life Care. So let's talk about COVID testing. So fortunately, over the last year, we've had a significant abundance of tests. In fact, there's many different styles of tests. There's home kits now, which are okay. They're reasonably accurate at 80 to 85%. However, I don't think that's something to bank on. If your home test is positive, I think you should consider either making sure that you do your COVID isolation and take the appropriate treatments, or if you're unsure and you think you need to go to work, we would recommend that you consider validation with a PCR test. This is still the best technology and the most accurate. Those are readily available as well. We certainly have no shortage of supply with regards to our testing as we had in the past. So that's been a big plus with regards to taking care of COVID over the last several months. So if you have COVID, what is your best route for getting tested? Again, there are home kits that are available. Their accuracy is not as good as we'd like them to be, although it's a reasonable option if you have no other choices. Ideally, I think the best course of action is to contact your PCP. We have readily available, accurate, high-quality tests now that are not really limited by quantity anymore. We also have the urgent cares, and they also, again, have access to the best tests available for accuracy, as well as to help you understand where you're at with regards to your COVID illness. I think it's also important that if you are feeling significantly ill, that you consider being evaluated by a provider. Very commonly, COVID is an interesting disorder because the person looks better than their x-ray or their oxygen levels suggest. And it's very important to identify that you're not doing well, because you may not actually feel as bad as your x-ray or your oxygen level looks. So again, I think it's important if you're feeling poor, if it's just a little cold, if you're not feeling terrible, that's fine, stay at home. But if you're really feeling bad, I think it's imperative that you come and seek help from your provider.